husband, who many of you know, is a physician, and he spent a little time in debates with some of his colleagues who tend to be a little more conservative. In fact, my husband's a little to the left of where I am. But he just simply closes his argument to fellow physicians who want the government out of their health care. He just simply says, get ready to raise the chickens. Because you remember back in the Depression era, what did doctors take for payment? Goat, a chicken, a cow. Get ready to raise the livestock, because that's what we may be back to. And if I can just, for a moment, have a moment of personal reflection, I will tell you, I do not believe that I would be standing here if government wasn't involved in healthcare. The thousands and millions of dollars that the government has contributed and invested in breast cancer research is a huge reason why I'm standing here today. And I am grateful to the American taxpayers for providing for that research. I'm grateful to a Congress who saw that research as valuable. And I am grateful for all of you who fight every day for American quality, affordable, accessible health care. Because without it, our quality of life would not be what it is. We would not be what we are as a people if we simply walked away. And the next time someone says, why not let the free enterprise system take care of it? I want you to recall this story. And it was a story that was on National Public Radio. And it was a story about a woman who didn't have health care. She was a skydiver, she climbed rocks, she did all these, fairly intense, dangerous things. She's a woman my age, in her 50s, but she was out living life to the fullest, but didn't have any concern about not having health care. But you know what? She had health care for her dog. She had health insurance for her dog. It's a true story. And everybody laughs about that and say, what is that about? And I said, it makes perfect sense. It makes perfect sense to me. Because there isn't one hospital that will deny her access so that she can get her leg fixed, right? Because we don't have a free enterprise system in healthcare. We have universal health care, as John Corzine once said. It's called the emergency room. That's where you go, right? We don't deny people their care. But when they can't pay their bills, who does? That's right. And so that's the system. And what if you show up with a dog with a broken leg and you can't afford a vet bill? Does your dog get his leg fixed? No. Absolutely not. So if you want, because you better come with cash or pet insurance or something that takes care of that animal. Or they will say, I'm sorry, we're not going to provide your animal with treatment. But we don't do that with human beings. And so when people say, let the free enterprise system work, ask them if they think that anyone who shows up who doesn't demonstrate an ability to pay should be denied services. Because that's the free enterprise system. If you go down to Best Buy and want to buy a computer and don't have any money, they're going to let you walk out with one? No, they're not. That's the free enterprise system. This country has never believed in the free enterprise system exclusively for healthcare because it's too important. It is too important to who we are and the fabric of who we are as a people. And so when people talk about the free enterprise system and letting the free enterprise system work, you need to give them a little lesson on the free enterprise system and ask them if they're the ones who are going to be standing at the door of a clinic or a medical facility telling someone no, because that's the only way the free enterprise system works. And we don't believe that when someone has a broken leg or has an emergent need for health care, you say no. That's who we are. And so we need to continue the discussion. We need to continue to have a dialogue. And I would say we need to continue to trust the people who know the most. And in this country right now, there's a whole group of people who would rather listen to what Sarah Palin has to say and Michelle Bachmann has to say about health care. Now, I ask you, if you were going to listen to someone If it was Kathleen Sebelius, and what you don't know about her, former governor, but she also was a former insurance commissioner from the state of Kansas. She knows a little bit about health. Who are we going to believe? Who are we going to remember in all of this? The people who are saying no to this bill today are the same people who would be standing here in 1964 saying no to Medicare. And we know it. We know it. Now they stand as defenders of Medicare, right? We know better. We know better. These are the same people who would have said no to Medicare. They're the same people who are saying no today. No today. We cannot be that country that guarantees that people have affordable, accessible, and quality health care for everyone. That has to be reserved. And another great argument that I hear all the time is, well, look at what happens in Canada. They go to the Mayo Clinic to get their health care. I say, well, a lot of people in Bismarck go to the Mayo Clinic. Does that mean we have bad health care in Bismarck? I mean, seriously, I mean, think about that. How many times have we heard they go to Mayo for their health care? And I go, I know a lot of people go to Mayo for health care because they're experts on certain things. It makes sense. And so, simply saying we've done it, it's over, it is, it's move ahead is not enough. We have to continue to be vigilant. We have to continue to defend our very, very, very courageous congressional delegation. This is a legacy vote. This is a vote they will look back on, and their children will look back on, and they will say, my red state Democrat grandfather or great-grandfather voted for that bill because it made sense. And I want to close with kind of a last visual because I think a lot of people wonder, why did Barack Obama do this? I mean, this was not an easy thing to do. And he took it on. And I think there's two reasons. Number one, I think he felt deeply indebted and deeply moved by the commitments of Senator Ted Kennedy, who we would have to all acknowledge here today was on the cutting edge of this issue, fought for years and years and years. And I think he's smiling somewhere up there in heaven, nodding his head and saying, it got done. Because a lot of terrific, millions and millions of terrific people across this country believed in it. They didn't have a lot of money, but they had a lot of voices. And they were right. And sometimes being right counts in America. But I think the other reason, and it's something that unless you have been there, I don't know that you can really comprehend. Here was a man who sat by the side of his mother dying of cancer. And her greatest concern is that she not burden her family with health care bills. He understands in a way not a lot of people understand how absolutely wrong that is in America. You understand along with him. Either you have empathy or you have personal knowledge, but you understand that that is wrong in America. That at the time when you most need health care, your health care is most threatened. And that is wrong in America. And so you need to keep up the fight. You need to keep writing on the blogs. You need to keep calling in to talk radio, telling people what you think. And you may not think those voices change, but when all of that noise is out there unanswered, it becomes reality. You need to be the truth tellers. On behalf of all of the people who now can get quality, affordable, accessible health insurance without worrying about pre-existing conditions, without worrying about whether they're going to have to make a decision whether to eat or pay their health care coverage, without worrying about whether their employees will get a reduction in pay instead of an increase in pay because you're buying health insurance. You need to be their voice. Like that lump in the throat of Nemo. Speak for the thousands who have not had a voice before. Continue your hard work. Do not let up until we can safely see this important reform in our rearview mirror. Thank you so much.